Hi, this webinar is on dental meaningful use attestations. In the past, dentists have had a hard time meeting meaningful use and have dropped out of the program. So we put this together to let you know that honestly it is easier than you think. We will be addressing Stage 1 and then Stage 2 MU. Stage 1, which is also known as Modified Stage 2 Objectives, this is for 2015 only. There are 10 objectives that replace the menu and core measures. In the past, for Stage 1, there were 13 core measures and 9 menu measures. The CQMs remain the same as previous year. There were no changes. Stage 1, there are 10 objectives. 1 through 9 are on this page. The 10th objective is a public health, and that will be on another tab. So you want to make sure and respond to all 9 of these objectives. You don't have to meet them, but you do have to respond to them. Stage 1, 10th objective. This is the public health measure. There are several exclusions available, and there's 3 measures within this objective you must respond to. Stage 1, 10th objective. This is measure 1 out of 3, Immunization Registry. The EP is in active engagement with a public health agency to submit immunization data. The first exclusion option, you can use, if you meet one of these 3 criteria, then you can exclude from that measure. Or if you are supposed to be in Stage 1 and you're testing in 2015, you can use exclusion 2, which is the alternate. Measure 2 of 3, syndromic surveillance. The EP is in active engagement with a public health agency to submit syndromic surveillance data. There are 2 exclusion opportunities. The first one, if you meet 1 or more of the criteria below, you may take the exclusion by checking yes. The second exclusion is an alternative for those who were supposed to be in Stage 1 in 2015, and there is no equivalent measure. Measure 3 of 3, specialized registry reporting. The EP is in active engagement to submit data to a specialized registry. There are 2 exclusion opportunities. If you meet at least 1 of the 3 criteria in the first exclusion, you may take it by checking yes. There's an alternative exclusion, and that is if you are going to attest for Stage 1 in 2015 and it does not have an equivalent measure, you may take the exclusion here. Stage 1, public health indicators. When you go to the public health measure tab, once you've finished answering your questions, you can tell the status by looking at the far right. If there's a red exclamation point, that means it is not complete. You'll need to go back. If there is a green check and it says complete, that means that one is complete and you've answered it correctly. CQMs for Stage 1 have not changed. You must respond to, not necessarily meet, 9 measures across 3 domains or sections. There are some exclusions that you can use for several of these that may be appropriate for your practice, but if there are no exclusions and the CQM does not apply to the EP or to the group, you may use a 0 in the denominator. This counts as a response. In Stage 2, there are also 10 objectives that replace the menu and core measures. They have no modifications or alternatives. In the past, it was 17 core measures and 6 menu measures. The CQMs remain the same and have had no changes. Stage 2, 10 objectives, 1 through 9. After you click on the MU Objectives tab, you will see the first 9 objectives. You must respond to each of the 9. You do not necessarily have to meet them. This is the 10th objective for Stage 2. You want to click on the MU Public Health Measures tab. On the 10th objective, this is measure 1 of 3. The EP is in active engagement with a public health agency to submit immunization data. There is 1 exclusion available. If you meet 1 of the 3 criteria, you may take the exclusion. Measure 2 of 3. The EP is in active engagement with a public health agency to submit syndromic surveillance data. There are 2 exclusions available. The first exclusion, if you meet one of the three criteria, you may take the exclusion and check yes. The alternative is if you were in stage 2 in 2015 and there was no equivalent measure, you can take this exclusion. Measure 3 of 3, specialized registry reporting. The EP is an active engagement to submit data to a specialized registry. There are 2 exclusion opportunities. The first one, if you meet at least one of the 3 following criteria, you can take the exclusion by checking yes. An alternative exclusion is available if you were to be in stage 2 in year 2015 and there was not an equivalent measure. Public health indicators. Once you are finished with that tab, look on the far right side and you'll see indicators. If there's a red exclamation point, that means it has not been completed and you will need to go back. If you have a green check, that means it is complete and you're successful with that measure. The CQMs for stage 2 have not changed. You must respond to, not necessarily meet, the 9 measures across 3 domains or sections. There are exclusions that you can use for several that may be appropriate for your practice, but if there's no exclusion and the CQM does not apply to the EP or to the group, you may use a 0 in the denominator. This counts as a response. Here's some helpful resources. You can contact us at healthit@hca.wa.gov with questions about your attestations. Please visit our website at www.hca.wa.gov/healthit for user guides and training. Also, sign up for Gov Delivery to receive important notifications and monthly newsletters. Go to our website and click on Communications to sign up and view archived newsletters.